Good evening to all. Myself, Dr. ILAMATHI JAYARAMAN, Assistant Professor of Biotechnology, DKM College for Women, Vellore. Today I am going to talk about cardiovascular medicinal plants. First, what is heart disease? Cardiovascular diseases are leading cause of death worldwide. It is leading cause of death for both men and women. Cardiovascular diseases are group of disorders that affects heart and blood vessels, arteries and veins. Cardio means it relates to the heart. Vascular means it relates to the veins and arteries. Atherosclerosis. Ather means much. Deposition of cholesterol in arteries. Next, myocardial infarction. It is also called heart attack. It is one of the cardiovascular disease. Myocardial infarction means interruption of blood supply to part of the heart. This is most commonly due to blockage of the coronary artery following the rupture of vulnerable atherosclerotic plate, which is an unstable collection of lipids and white blood cells in the wall of an artery. What are the types of cardiovascular disease? The most common heart disease are coronary artery disease, CAD, coronary heart disease, ischemic heart disease. Ischemia means insufficient oxygen and blood supply to the part of the heart. Cardiovascular disease, pulmonary heart disease, hereditary heart disease, hypertensive heart disease, inflammatory heart disease, valvular heart disease, pericardial disease, congenital heart disease and HF, heart failure. Next, risk factors of cardiovascular diseases. First one, high blood pressure, low blood pressure, stress, depression, obesity, diabetes mellitus, smoking and physical inactivity, lack of exercise, hyperlipidemia, increased levels of serum lipids such as free fatty acids, total cholesterol and triglycerides, family history, age, high fat diet and excessive alcohol consumption. This slide shows the symptoms of cardiovascular diseases. First one, chest pain, nausea, vomiting, palpitation, it means irregular heartbeat, edema, injury or inflammation, anxiety, increased heart rate, shoulder pain, sweating, shortness of breath, dizziness and difficulty breathing. Next, how is heart disease diagnosed? First one, laboratory testing, blood test. It measures cardiac markers or cardiac enzymes. First one, CK-MP. CK means creatine kinase, MP, muscle and brain. Increased levels of CK-MP indicates death to heart muscles. Ischemia, modified albumin. Ischemia means insufficient oxygen and blood supply to the part of the heart. IMA, increased levels of IMA indicates lack of oxygen supply to the part of the heart. Next one, myoglobin test. Myoglobin is a muscle protein. Increased levels of myoglobin in serum proteins indicates damage to the heart muscles. Next one, troponin. Troponin INT, tropomyosin binding components and tropomyosin inhibitory components. Increased levels of troponins indicates heart damage. Next one, increased levels of cholesterol such as free fatty acids, total cholesterol, triglycerides. It indicates the heart damage. Next, graphic recording studies. It is used to detect heart disease. First one, ECG, electrocardiogram, electrical activity of the heart. Next, exercise, ECG. It is also called stress test. Next one, imaging studies. First one, chest X-ray. It is to detect enlargement or structural changes of the heart. Echo, to visualize heart size and shape, heart wall thickness and motion, cardiac wall structure and function. Next, CT, MRI scan to detect changes in the structure of the heart. Next one, interventional studies, cardiac catheterization and angiogram. It determines location of the blockage, pressure, oxygen levels of the heart. Cardiovascular medicinal plants. Examples, vanilla plant, aloe vera, tomato, onion, carrot, green tea, orange, lemon and beetroot. First one, vanilla plant. Its scientific name, Vanilla planifolia. It belongs to Apiaceae family. It has wide range of phytochemical activity. Phytochemicals. One of the phenolic compound is vanillic acid. Chemical name 4-hydroxy-3-methoxybenzoic acid is a dihydroxybenzoic acid derivative used as a flavoring agent, mostly found in fruits and vegetables. Ferulic acid, vanillic acid, it protects against myocardial infarction. This slide shows the pharmaceutical activities of vanillic acid. It has wide range of pharmaceutical activities like cardioprotective activity, antioxidant activity, free radical scavenging, anti-diabetic, anti-inflammatory activity, and anti-cancer activity. Next plant, garlic. Scientific name Allium sativum. It belongs to Alliaceae family. It has wide range of phenolic compounds and polysulfide. For example, quercetin, S-allyl-cysteine and N-acetylcysteine. It contains high levels of blood thinning components. It prevents the formation of blockage of the arteries. It maintains BP, cholesterol and formation of blockage for formation in arteries. It helps cure hypertension. It reduces high cholesterol level. This slide shows the mode of action of garlic. It has wide range of pharmaceutical activity like cardioprotective activity, antioxidant activity, hyperlipidemic activity, anti-inflammatory activity and hepatoprotective activity. Next plant, aloe vera. Scientific name Aloe barbadensis. It belongs to Liliaceae family. It reduces cholesterol, triglycerides and free fatty acids. It contains high levels of phytochemicals like phenolic compounds, alkaloids, terpenoids, flavonoids, tannins, anthraquinones and polysaccharides. This slide shows the pharmaceutical activity of aloe vera. It has wide range of pharmaceutical activity like cardioprotective activity, anti-cancer activity, anti-ulcer, anti-inflammatory activity, wound healing properties. Next plant, tomato. Scientific name Solanum lycopersicum. It belongs to Solanaceae family. It contains phytochemicals like phenolic compounds, lycopene. It inhibits CRP protein. CRP means C-reactive protein. It is an inflammatory marker, thus reducing the risk of cardiovascular diseases and stroke. Next plant, Allium ceiba, common name onion. It belongs to Amanidaceae family. It contains phytochemicals like polyphenolic compounds like allicin, quercetin, physdin, other sulfurous compounds like diallyl disulfate and diallyl trisulfate, N-acetylcysteine. N-acetylcysteine used for cardiovascular disease treatment. Next plant, carrot. It belongs to Aviaceae family. Scientific name Douglas carota. It reduces the risk of cardiovascular diseases. It helps with vision and aging. This slide shows the phytochemicals and pharmaceutical activities of carrots. It contains phenolic compounds, carotenoids, alkaloids, terpenoids, and polyacetylene and ascorbic acid, also called vitamin C. These chemicals it reduce the cancer and cardiovascular diseases because due to its antioxidant activity, anti-inflammatory, plasma lipid modification and anti-tumor properties. Prevention of cardiovascular disease: stop smoking, managing health weight, regular exercise, following a healthy diet, limit intake of the following salt, sugar and processed carbohydrates. Prevention is better than cure. Thank you.